call the meeting to order. Roll call, please.
Markham? Here. Middleton?
Here.
Quarles?
Here.
McGillivray?
Here.
Powell? Miller? Long?
Here.
Koa? Zach?
Here. Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. With that, I need a motion for the approval of the minutes. Moved by McGillivray, supported by Middleton. Any discussion? All those in favor say aye.
Aye.
Any opposition? Motion carries. Approval of the agenda. We have a proposed walk-on of communications of item J, which is a copy of the letter to all Oakland County elected officials, department directors about the budget, as well as the proposed budget hearing schedule. And I do want to talk about the budget hearing schedule. We are going to move up the time of the beginning of our finance committee on July 24th to 9 a.m. and Wednesday, August 28th to 9 a.m. We're going to keep the Wednesday, August 7th at 9:30 because a claims meeting has been scheduled. So we will make sure that we remind you about the earlier times. So with the amended agenda, do I have a motion as amended? Long, supported by Markham. Any discussion? All those in favor say aye.
Aye.
Any opposed? Motion carries. Do I have any public comment today? Seeing none, I will close the public comment. First item is communications. Do I have a motion on that, for that? Markham, supported by Kowal. Any discussion? I do have a question on, what, anybody else have a question before I? So on item number B, and it is the Main Street program, and you know, it's a contract exception report on that for AV rental and support for $7,400. And my question is, I know that the event was held about a month or two ago, and why am I seeing this after the fact?
Typically, you would see these after the fact. As I recall, this is the first time, and we've used the Strand before, that we have done an exception report. So the question is not on the Strand, it's just on the timing of the exception. Scott Guzzi, could you assist?
That's when we received the invoice, we knew about it. So it was planned, but we did not know prior to this, when we would see the.
Okay, so we approved the amount before the contract exception report came through? Okay. There's a piece of me that would like to know about it proactively versus voting on it afterward.
That's understood.
So, any other questions about communications? Seeing none, voice vote? Okay, all those in favor?
Aye.
Anybody opposed? Motion carries. Item number 1, Circuit Court Family Division, Oakland County Child Care Fund Budget. Is there a motion? Okay, Commissioner Quarles, supported by Commissioner Markham.
Hello.
Welcome.
Thank you.
My name's John Cooperrider. I'm the court's business manager, and with me is Tina Lathers, who's the chief of the Casework Services Division. And to my right is Tom Shire, who's the director of our local Department of Health and Human Services for Michigan.
Good morning.
And good morning, we're here to present the 2020 Child Care Fund budget. The Child Care Fund is a funding arrangement that's established by statute whereby the county and the state share equally the cost of care for delinquency, neglect, and abused youth that are under the circuit court's jurisdiction. Types of costs that we share include independent living, institutional care, foster care, facility care, which is our children's village, and in-home care costs. The court currently has 6 in-home care programs. They're each designed to keep the youth in their home and in the community, thereby avoiding some of the more costly out-of-home care costs through placements. There is one significant change this year in the Child Care Fund formula. It's with the state pays first legislation. Up until now, the county has always been responsible for paying 100% of the costs up front, and then the state reimburses at 50%. With the state pays first legislation that takes effect October 1, for neglect and abuse cases only, the state will pay 100% of the costs up front, and the county will reimburse 100%, or 50%, I'm sorry. This is all relatively new. We're still working out some of the details. We have some meetings with the state and some training supposedly next month, and hopefully we'll know a little bit more about the impact and where this will take us in the next into the future. So with that being said, we're happy to open it up for questions if there's questions.
Commissioner Middleton.
Was this change because of cash flow with us or with other counties?
I think it had to do, they think that they can get it paid, bills paid quicker to some of the foster care agencies. Is that correct, Tom?
Yes.
Yeah.
Okay.
So that was the idea behind it. Whether that actually happens, I guess we'll soon find out, but that was the idea behind it.
Okay.
Other questions? I have a question. What's our census these days? You know, are we running average? How many people are in this child care fund?
Yeah, it is about average. I would say maybe over the last 3 or 4 years, it's about the same number of population in the institution. They'll care for at least for the court piece. I'm not sure exactly about some of the DHS, I think, population, the neglect and abuse, but Tom probably could speak to that.
Yeah, we've been pretty consistent over the past several years in regards to the number of youth who are county child care funded in both family foster care and in our CCI residential facilities. Where we've seen a little bit of some decreases in regards to our independent living cases. So we've had a decrease in that amount. So over the past several years, our budget requests have gone down, and we've made numerous attempts in regards to decrease the amount of kids in care in order to impact the budget. So,
Roughly, how many are we supervising or in care?
well, our total foster care population in Oakland County, including all funding sources, is approximately about 678 children.
Okay.
And that's been a significant increase or decrease over the past several years. We were about at 800, so we've been making a lot of movement in regards to reducing our population, which is a positive thing, obviously.
Absolutely. Any other questions? Seeing none, let's call the roll.
Markham,
Yes.
Middleton,
Yes.
Quarles,
Yes.
McGillivray,
Yes.
Powell, Miller, Long,
Yes.
Koa. Yes. Zach.
Yes. Motion carries.
Thank you.
Thank
you.
you. Next item, Sheriff's Office Forensic Laboratory Reorganization. Do I have a motion? Commissioner McGillivray, supported by Commissioner Quarles.
Good morning. I have Captain Joe Quisenberry with me, who's head of the Investigative and Forensic Services Division, and of course, you all know Gaya, our Chief Fiscal Officer. We were in front of the Good Commissioners Committee here yesterday on this. This is a reorg for our forensic laboratory that we've been working on with the Human Resources Department for actually, maybe close to a year and a half. And we've finally got it to where we like it. There's several employees being reclassified with better pay. We are competing against the only other accredited lab in the state of Michigan is Michigan State Police, and so and they are paid considerably more for the same type of job that these employees are performing. So we did a study and we worked really hard with HR, like I said, and Captain Quisenberry and his staff did a great job in GAEA here. And we're also competing against the private sector with the legalization of marijuana. We have private labs now recruiting our chemists, wanting to pay them a lot more money than what we pay them. So this is something that will help us retain and recruit employees within the forensic laboratory system, and specific questions can be answered by either one of them.
Do I have any questions here? I have a question. Will this make us competitive in the marketplace? Do you think that?
Yeah, I mean, we're still not going to be up at the top, but we will be competitive, and we feel confident that this will allow us to recruit and retain.
And I also saw that we are streamlining some titles, simpler to administrate too.
That's correct. Yeah, like the investigators. This has become a science. It's not necessarily police work anymore. Crime labs, forensic labs in the past have always been associated. Oh, it's the cops. It really is. They're all scientists, is what they've become, and that's what this profession has become.
Commissioner Murphy.
Yeah, just a quick follow-up on that same subject. So you used to have people classified as a biologist or a chemist and that sort of thing, and you've just basically...
We've retitled them, given a more appropriate title.
Does that give everybody more flexibility to work? Were they limited in the past by what they were called, or can they be assigned to any particular task at a time? I mean,
Yeah,
so
what you're saying is true.
Just speak to that.
There's 5 disciplines in the lab: biology, chemistry, toxicology, latent prints, and firearms. And a technician in one can do some of the duties of one discipline versus the other. But since it's all based on its particular controlled quality control reporting, they're almost the same thing except different substances. So in fact, yes, we'll have the ability to move from one discipline to the next easier, and they'll all be at equal, say, compensation packages this way. So therefore, we're going to have a more efficient, we believe, structure in place for operations. Now, we've always been, this is a salary restructure, but the operational aspect has been in place now for a couple of years. And we had to do that because of accreditation purposes.
Thank you.
Any other questions? Seeing none, let's call the roll.
Middleton,
Yes.
Quarles? Quarles?
Yes.
McGilvray?
Yes.
Powell?
Yes.
Long?
Yes.
Colwell? Yes. Markham?
Yes.
Zach?
Yes.
Thank you very much.
Motion carries. Item number 3, Area Agency on Aging 1B, fiscal year 20 to 2022 annual implementation plan. And this is a report to the board. And do I have a motion? I have Commissioner McGilvray, Commissioner Kowal, and welcome. You want to introduce yourself again?
Good morning, Michael Carson, the President and CEO of Area Agency on Aging, 1B.
Jim McGuire, Director of Research, Policy Development, and Advocacy at the Area Agency on Aging 1B.
We're glad to be here, so thank you very much for having us. We are here with our 3-year plan. It's a plan that we put together that we present to the counties, and then after following our presentation to the county and support, we then go to the State Commission on Aging. Our Agency on Aging is one of 620 throughout the country. We have approximately 737,000 people in our region. Currently in Oakland County for 19 years, over 300,000, with the projection of growing 5,000 to 6,000 a year coming out in 2040 at just shy of 400,000. That'd be people 60 years or older. So the population is increasing, and the work that we do has always been important, will take on more importance with serving many, many more people. We do have about 30% of the elderly population within our region, and our region's made up of Oakland, Macomb, St. Clair, Monroe, Livingston, and Washtenaw counties. So we are proud of the work that we do. It was started by an act of Congress, and we're part of the Older Americans Act, and then Michigan has the Michigan Act is called the Older Michiganians Act, and that's how we get our funding from those two sources as well as money from the counties. So today, as I mentioned, we're presenting the multi-year plan. We're asking for your approval for the plan, and we'll give you some of the highlights of what we're doing. We've had 6 public hearings, and we had a hearing in every county, and from those hearings, we gathered the information from our plans, and then we got feedback on areas of importance. We also had 2 listening sessions when we had the plan pretty much cohesively developed, and we had one in Southfield and another one in Ann Arbor. We took that information from those hearings and we put that forward in our plan. So we're currently looking at about $23.5 million a year for 2020, and that is going to be part of grant awards for community organizations as well as some direct services. We've also done something a little different this year, and we have put a dollar in many categories that we didn't normally fund in years past. This will allow the agency flexibility to react to needs without going back to the State Commission on Aging, and also allow us to move funds to these different categories without going back to the Commission on Aging as well. So it's giving us the flexibility to look forward for 3 years and decide what needs will there be, and then how can we react to those in a more timely manner. Something new in this plan is our gap filling service, which is a funding of $10,000 for the first year for unmet needs for older adults, a one-time occurrence where they might need something done in their home or for their life to help them remain independent and secure in their home. And we also want to take the time, because Oakland County has been extremely generous, giving us $600,000 to help us get people into our programs that have a high need, and we appreciate that, and we are very happy to say that that program is very successful, and we're moving our residents from Oakland County forward, so thank you for that. In 2018, we touched many lives. Our information assistance was one of the most touched. It's our referral base. It's unbiased information at anyone that calls the agency. So we help them from meals, housing, Medicare, Medicaid, whatever plans they need, as well as services in their home. Congregate meals are all over our county areas to make sure that people 60 years or older can go to these sites and get meals. And of course, home delivered meals or Meals on Wheels, a huge program, as we're seeing increasing needs as well throughout the different counties, especially Oakland. And our most funded, Home Delivered Meals, which is a huge program for us. Again, the Congregate, our Community Living Service was the money that came forward to make sure that our highest need people, or our zeros, were taken care of. That continues to be highly demand. We have a waiting list throughout our counties for people that are scoring 1 to 5. The zeros are the highest needs, so that we are continuing to look at that waiting list to see what we can do to bring that down. And of course, dementia, our day centers as well. We are doing things a little different. We want to get more into the research and the demonstration of our projects to get evidence, data, and to make sure our decisions are driven from that, and especially with our advocacy program and our system change and our management. Our advocacy will still continue to be very strategic as we move forward for state, federal, and local support for older adult services. We're initiating our measurements and reports of our outcomes. And what we're seeing is people want data now, and they want to see that our programs are really bringing results. So we have to not only administer the programs, but we have to be able to turn around and say that our programs have been effective and how we're changing the lives of people. So that's a lot of what we're doing. We also are looking for caregiver-friendly communities, so we're going to incentivize communities to become part of that, to be more aware of what is needed. And then we started our philanthropy or fundraising, and we are first year into it, which was very successful. We are now really building a foundation in that, as well as grant activities. Our grant programs have been very successful in getting money into the agency for different type of initiatives that we're doing and things that are needed to bring other services forward. We're increasing our support for public transportation and this need to make sure that our seniors have the transportation necessary to go to doctor's appointments, as well as pharmacy, even grocery shopping, or it could be just to an outdoor activity or an activity that they want to leave their house so they're not isolated, as well as our wellness programs and looking at the private pay market to see if there's other resources besides our Medicaid program, as well as the money we get from the Older Americans Act. And then, of course, we have a medical nutrition therapy program that we're rolling out. We've been working on that for a number of years, and this will help people with diabetes and other nutritional needs. And then, of course, one thing we heard very loud and clear at our public hearings with grandparents raising grandchildren. It's a huge need in the community with the opioid epidemic and other things going on, that people in their later years that have money put away for retirement are now getting the responsibility of taking on children. And what does that mean for them, the hardships that they're having financially, as well as being able to take these children to the hospitals and getting authority to approve care, and then what to do when they need resources and other things. So we looked at all those things, and while it doesn't fall within our funding source in a clear way, we are looking to see what we can do from an advocacy program and to see if there is any way with one or two sections we might be able to help support them. So it's an initiative that we're proud of. We'll continue the good work that we're doing and always looking for input and ready for questions.
Commissioner Long?
Okay, I know that the home care is, a lot of elderly want to stay at home more. Is there a more elderly requiring home care than caregivers available?
You bring up a very good point. There's a very big caregiver shortage. We're finding that throughout all of our areas that we serve, and it's hard for them to retain once they hire. And then we have areas where we can't even serve because we can't even have agencies that will go out. So we've done a lot of self-evaluation to see, can we increase what we pay? We also look, can we increase the hours needed? But to your point, there are people, we currently have about 220 cases in our queue that we cannot serve.
Okay. I thought that just because I was a nurse, and then when I was a nurse's aide going through college, it was like the pay is so low and it's such a demanding job, so.
Yeah, there are some grants that have come forward to help train for certified nursing assistants. Though most likely will go towards nursing homes because they'll get paid more in the nursing homes and not have to do the windshield time or driving from point A to point B. But it is a problem. It's a problem statewide. I believe it's a problem throughout our country. I know it's getting a lot of press and a lot of people are looking at it. There's not an easy fix. You can go to McDonald's and make as much money as you can, taking care of somebody.
I certainly hope, because it's really nice to keep the people in their homes, so.
It is, and we always look for family as well to see if family can take on that role and we can help that way.
Okay, thank you.
Thank you, Commissioner Middleton.
Yes, you mentioned that you were putting $1 in the budget for a placeholder. Is there a limit to how much you can add to that category? Or, and where would you get the funds to be able to move it into a placeholder budget?
So the way the money comes from the federal government, state, and the county, it goes in specific categories, and within those categories, we put $1 just to open the door for those funds. So within the category, there could be $2 million, and we might be putting $2 million into one section, and we might decide at some point to move 500 to another area to open up a new program.
Okay, so, and that'll allow you to do
That just allows us to do it without having to come back in front of the county, discuss it, and then go back to the State Commission on Aging and then get approval to do it. This way, our plan is really looking forward in that sense, that if we have the dollar, then it allows us that flexibility to respond without having to go through the different steps.
And when the funding source approves your budget, they see those dollars, they know right away that that's a placeholder, and
Yeah,
they're of understanding that that's going to happen.
This will be our first time going in front of the State Commission
you'll find
with this
out.
dollar amount. It's not unusual, but I've also learned as well, there are about 5 or 6 new commissioners at the state level that were just appointed, and they'll be starting in August. We're going in front of the commission in the beginning of August. So
Okay.
we will hopefully educate them and hopefully get their approval on this. But it was recommended by the state of Michigan. Our Office on Aging suggested that we do it in a way to be more fluid, more responsive, and to be able to move our funds around.
Okay, okay, thank you.
Commissioner Markham?
Thank you. Good morning, and thank you for your presentation. I'm interested in public transit, especially for seniors. Can you speak a little bit about how you support that and what you think the needs are and if we need to be doing more?
Sure, I'm going to ask Jim to respond. He's very involved in that.
Okay.
Sure, we don't provide directly transportation services. We're involved in a planning and an advocacy role, although we do have one regional transit authority brokerage program where we help people how to figure out how to use public and private transportation services to get to point A to point B. Usually it involves crossing county lines, which can be very difficult with our services. But from an advocacy perspective is where we're most active. For example, the House just passed a 70% cut in the small bus service, specialized services program that many of the senior centers and local nonprofits use to take people door-through-door service. And we've spent a lot of time talking with some of our friends in Lansing on the transportation committees about the ramifications of that in terms of the impact it'll be. So it's primarily from advocacy and a planning perspective.
So not to put words in your mouth, but I think what I'm hearing is that it's a problem that really is not getting necessarily the attention it's gonna need going forward, because more and more of us are gonna need transportation. And it doesn't sound like it's adequate yet. What do you think we can do to help that as the county commission?
Well, transportation for the older adult population is very localized. I mean, it's someone from Madison Heights needs to get to Troy, and the local bus may not cross that boundary. So a lot of it is supporting the local programs to have the flexibility to go to fill in the gaps of what SMART doesn't do in terms of service. The problem is we're keeping a much more physically frail population in their homes, a nursing home population for many of our programs essentially. But they still need to get to prescriptions, need to take care of other business, and so the demand on those specialized services that help people get through their door into the down this walkway into the bus, that's what public transit authorities like SMART did not provide, and that's what we depend on the specialized services provider network to do. But in terms of, so there are gaps in different communities. Hazel Park goes maybe 15 miles beyond their borders. Rochester doesn't leave their borders with public transit services. And those are, so to address the question, it's a community by community basis almost.
Thank you.
I have Commissioner Colwell, then Commissioner Mill.
Thank you, Madam Chair. A couple of things, I guess. First of all, it's the Grandparents as Parents program. I remember years ago I served on the OLSA board, and they also, so I guess I sense there's overlap in a lot of different programs, but I imagine you're working together on this issue with OLSA.
We are at our public hearings. The members from OLSA and other grandparents and the people, seniors in that position, came and they spoke. And our advisory council does a study session each summer, and we have someone from OLSA on that as a representative to look at grandparents raising grandchildren and what steps need to be taken. So yes, we work very collaboratively with them.
Sadly, it's a growing epidemic, I imagine, along with the drug epidemic that's going on, and grandparents are having their grandkids left in their laps to take care of. So thank you for doing that.
Yes, we appreciate that, and we know that financially it's a huge hardship for them as well.
Right.
I know that we're looking at what we could do through advocacy to try to help them. If they were foster homes, if they were foster care for parents, they would get funding. As grandparents are getting nothing. So yeah, it's a big problem.
Okay, my other question has to do with Meals on Wheels. I guess I need to understand a little bit more about the actual structure. I mean, where are the meals made? Does it vary from area to area? You know, we've been approached about a Meals on Wheels kitchen just inside Livingston County on the border of Oakland and Livingston County. But my understanding is that a lot of this happens maybe with local senior centers. Where are these meals put together and delivered from?
We have contractors throughout our region. We have approximately 6 to 8 contractors in Oakland County that currently make meals. Some will use school cafeterias, some will use church cafeterias. So everybody uses different kitchens to prepare those meals. I believe that one you're mentioning is currently in a church, and they're looking for a permanent location to prepare meals, because we talked about that when I was here on Monday, and I called my dietitian as soon as I left, and I said, please explain that to me, because I've never heard of anyone going to a county asking for $1 million to build a kitchen. Because I thought, wow, we should have come and asked for $1 million to build a kitchen as well. But no. Yeah, exactly. But yeah, they're a good provider. They need a home, and I know that they're looking for support from 2 different counties to get that. It's unusual. I've never heard it. Jim's been around longer than myself. Maybe he's heard of that before, but I've not.
And it's the contractor that serves both western Oakland County and all of Livingston counties, and they've been in that role for probably 15, 20,
Yeah.
25 years.
So they need the space. We have some funds to help people get equipment and other things, but we do not have funds to help someone set up a kitchen.
Thank you.
Commissioner Middleton.
Yes, and to the chair, we saw the commissioner appointees to the, one's a commissioner and one's a citizen to the area agency.
So it is Commissioner Lubes is now the commissioner, and we still have Ron Borgesser as our citizen.
Okay, Ron.
Yeah.
We have two wonderful representatives, so.
Yes, very much so.
Other questions? I have a question about the community living program and the risk level. And when we allocated the $600,000 toward that, it was to take Oakland County residents off that zero. You know, we had, at the time, I thought we had about a couple hundred people that were on a wait list with a zero risk factor. Where are we at with our Oakland County residents? You know, I was hoping that we were gonna, you know, that we would clean up the wait list and that we would be on top of it as it came in. Where are we at as
With
far
this-
as serving those high risk?
The high risk, the zeros, we are on top of the zeros and we're using the funds accordingly. We're also looking at additional funds that we can put from our other sources to help do that. So we are on top of that. What we are looking at though is the list in general. We have people calling our resource center, and we're adding anywhere from 30 to 60 people a week onto this list. And what we're trying to really understand is, where do people really belong, and do they belong on that list? So we're looking at a lot of different approaches. One is to have people go out and assess everybody goes onto a list in our agency to figure out, do they need this program, or do they need something more intensive, which might be our Medicaid program, where people meet nursing home level of care. We're also looking to make sure that people are not on both lists. Sometimes they'll put on one list when they need the other list. So we're looking at the list in general. Currently, people that are, it goes from 0 to 5, and if you look at the zeros and the ones, we service the zeros everywhere. The ones are a little difficult. If you're a 3, 4, or 5, you'll never get service on this list because there's not enough dollars there to meet everyone's needs. So we're really trying to understand what those are. And we're currently doing telephone assessments. So when someone calls in on this list, we call them up and do a telephonic assessment to decide what level they're at. We're looking at that to make sure that if the telephonic assessment matches if we do an in-person assessment. A lot of times we find people are hoarders. People could have an infestation of, you know, insects. They could have bed bugs. They can have spoiled food. Seniors, like anybody, are very proud, so when they call and they say what their needs are, a lot of times they're saying their needs are a lot less than what they really are. So we have people on zeros that only want 1 hour twice a week for help in the shower. And if you think of a zero, they should almost need 10 hours. They should be the highest level. So we're looking at it across the board to make sure that the system that is in place really works, and that how we're putting that out there, the services, really makes sense for that. And so we're looking at it in general, but back to your point, we are taking care of our zeros.
Thank you. Commissioner Long.
Just, that brought up another point. So if someone calls for one time and they're approved, they're not on a list of a 5 or something that you could do a one-time appropriation or help someone for one thing?
No, anyone that
How does that
calls in
go?
goes on the list.
Okay.
And with this list, the higher the acuity or the higher the need, you get closer to the zero, which zero doesn't make sense to me, so we have to really look at that. I mean, the idea of a zero is a negative for that. It's interesting. But the zeros always will float to the immediate. So within 1 to 2 to 3 weeks, they're having service in their home. It's the other people that have less needs that might need a couple hours of housekeeping or something else. What we are finding in our programs, people really want to have an aide come into the home to help them with transportation. To the earlier question, they need to get to the pharmacy, to the doctor. So when we're doing a person-centered plan of care, a lot of times they want transportation. The problem is when you have an aide who's not making a tremendous amount of money and has transportation back and forth, they might not have a reliable car. not be reliable enough to take somebody in the car and drive them from appointments A to B. Plus, some agencies are refusing to take the cases because of the transportation component. They don't want their aides taking on the liability of putting someone in their own car and driving them around. So transportation is a huge, huge need out in the community, as well as the other services. But we are seeing a blending where if we separate the service and take transportation out of it, can we serve more people that really need that medical and that home assistance? But then what do we do with the transportation component? So we're really studying everything. It's very complex. It's not easy. And again, if we had the right funds, if we had enough money, we could do everything for everybody.
Okay, and then the, 211, is that like a one-time thing, you know, to call? Is that more of a one-time if someone had one thing, or no, that's more for bills and stuff, isn't it? Like
Yeah,
for like
when they
your
call,
heating?
when they call and they go on the list, they need ongoing support and care.
Okay, do they collaborate with you also? If someone calls, do they contact you?
I say, most of the senior calls that they get, if they require referrals for services, they actually get referred to us, and we
Okay.
do the more in-depth analysis, so we are they're like a feeder to our information assistance program.
Okay. But a lot of that, is that more for, which I thought, because I referred a couple people there, isn't it like a lot of it, they can help someone with their bills, if they had trouble with their bills, with consumers or something, they guide them? Okay, I want to make sure I'm referring people the right
Yeah.
way. So, okay, thank you.
Just a clarification, 211 is an information and referrals program run by United Way. And it's supposed to be comprehensive, any type of human social service need. So, and so it is,
So I did tell people to call that.
yes.
Okay.
I'm gonna take Commissioner Quarles first and then Commissioner Kowal for a second time.
Thank you, Madam Chair. Something you said about transportation brought up a issue that I've seen recently, and that is, so if people are looking for their medication and need transportation to get to their medication, I've been told that many of the chains of pharmacies are now putting in place some type of delivery service
Yes,
to.
they are.
Is that part of something that you're working with them or coordinating with them on?
We have the information in our resource center, so
Okay.
we can do that. With seniors, though, it's not always as easy. A lot of times there's confusion with setting up the medications. There's a lot of different things that need to be done when it comes to the home. But yes, for the ones that are cognitive and they're fine, yes, those services are out there, and we do talk about that.
Oh, okay. And part of that delivery of medication to the home is not the pharmacist or the person, the technician that's coming, does not set up the I'm thinking of those cases that have Monday, Tuesday, Wednesday.
No, usually it's a family member, or it's a caregiver,
Oh,
or
okay.
sometimes a nurse will do that.
All right, thank you.
Yeah.
Thanks, and Commissioner Kowal.
Thank you. When you mentioned earlier trying to, assess people and doing the telephone interviews, but not getting the full picture, first of all, for the outreach, can a relative or a friend of this person contact you for services, or does it have to be the person directly? Or do you maybe reach out to family or friends to get any input, or is that an issue with privacy?
No, it's a great question. Anyone can call and put someone's name on the list, but what we're finding is, as we're going through, there's a lot of hospital discharge planners that are calling and putting someone's name on the list, and when we finally get around to calling the person, they had no idea their name was on the list. So it takes up a huge amount of space. So what we're talking about is taking those phone calls, but then confirming with the person that they want the service. So we feel at times professionals are just checking the box at the hospital saying that we put them on a list for services, and then our list looks really large and we get down to it, they don't need it. The other thing that we're running into, to your point, is when people are put on a list, a lot of times it's post-hospitalization and they rehab and they get better. By the time we call them, they don't need the service. So we run into that as well. But yes.
I'd like to add to that, historically, about 30% of the callers to our information and referral line are generally family caregivers calling for, mom or dad or someone.
I just was wondering how you might get a better picture of, you mentioned the hoarder situation and
We're really talking about
other issues, yeah.
We're really talking about having the client that needs the service confirm that phone call before we actually put them on the list. So we're really looking to tighten up our list to make sure it's worthwhile. In our programs, we have some people that are going out and doing field assessments, and they're driving from point A to point B all day long, and people don't even qualify for the program. So there's a high level of burnout and frustration from our professional staff, and part of our responsibility is to make sure that we give them names, that we vet them as much as humanly possible and that we're allowed to by law, and then get them out there to make sure that we're hitting more 50 to 60% of those.
Are you done? Okay, Commissioner Powell?
When you said there's requirements to render services through this, is it income requirements, and is it if you have insurance, you don't, Medicaid, Medicare, like, what is the qualifications for a senior to qualify for service?
Currently, we don't ask for a copay type of style where we ask them to support what we're doing in service because we've had enough funds of late to be able to do that. But as it goes forward, we could ask them to pay or contribute to part of the cost of these programs.
Okay,
But yeah, the funding has not been a determinant factor at that, yes.
okay, so anyone in Oakland County can call and just see if they can render services?
Correct.
If you all can,
Correct, and
Okay.
then again, it comes down to what other services are out there, because what keeps me up at night are people that need some level of services that are on a waiting list that have a score that won't get them the services because we're taking care of the most immediate need.
got it.
So then we're always looking at what other resources are available in the community to get someone more services faster,
Okay,
than putting them on a waiting list and then they can be there for a long, long time.
I feel the need to clarify that a little bit. So the information referral service is for everybody, and I always refer there. But when you talk about the chore services, the at-home, those are usually income screened for those types of services. They're the lower income. It's not a wealthy person that can get free chore services. But there is a program that is offered through the Area Agency on Aging for people who have more income, and using a lot of the resources that they offer.
okay, that's good to know for I actually was asking for my father. I need to get him some.
Not just understanding that there's different.
Yeah, but he has more, he has good insurance, he has more of the funding to probably contribute though.
But
So I
they're-
was just trying to wonder.
So they're a great starting point, and they'll help triage it into different
Yes.
services.
Okay,
By all
thank you, thank you.
Other questions? Seeing none, let's call the roll.
Quarles,
Yes.
McGillivray,
Yes.
Powell,
Yes.
Long,
Yes.
Caldwell,
Yes.
Markham. Yes. Middleton. Yes. Zach.
Yes. Motion carries. Thank you for coming.
Thank you for your support.
Thank you very much.
Do we have any other business today? Come before the committee? Seeing none, I'm gonna move that we adjourn at 10:15.